You can run a marathon. You can have perfect cholesterol numbers. You can exercise 5 days a week, eat clean, never smoke, and feel completely fine, and still die from a heart attack without a single warning. This is not rare. For 50% of men, the very first symptom of heart disease is sudden death. Not chest pain, not shortness of breath, death, and for 60% of women, the same. No warning, no time to react. So how does a healthy heart fail? And more importantly, how do you check yours before it does? To understand this, we need to look inside the arteries that feed your heart. The heart is a muscle that demands more oxygen than almost any other tissue in your body. It gets that oxygen through a network of vessels wrapped around it called the coronary arteries. Think of these vessels as the root system of a tree. If you cut a small root, you lose a leaf. If you cut the trunk, the entire tree falls. The most important of these vessels is called the left anterior descending artery. In emergency medicine, it has a nickname, the widowmaker. It supplies blood to the front wall of the left ventricle, the heart's main pumping chamber. A blockage here does not cause a small heart attack. It causes a catastrophic one. But here is what most people get completely wrong about how blockages form. A healthy artery is flexible and smooth on the inside. Blood cells slide through effortlessly. But over years, factors like high blood pressure, elevated blood sugar, and chronic inflammation act like sandpaper on that smooth inner lining. Microscopic tears form. Your body sends LDL cholesterol to patch the damage, like spackle filling a crack in a wall. The immune system sends white blood cells to inspect the repair. Those cells consume the cholesterol, harden, and eventually form what we call plaque. Now here is the part that gets people killed. Most people imagine plaque like a clog in a drain. The pipe slowly narrowing until one day the water stops. They assume they will feel it happening, that they will get winded climbing stairs, or feel pressure in their chest as the artery closes. This is biologically incorrect. As plaque grows, the artery wall actually expands outward to accommodate it, preserving the opening for blood flow. This is called positive remodeling. It means you can have a massive buildup of plaque while the artery remains completely open. Blood flows normally. You feel nothing. You can run a 10-kilometer race and feel fantastic because the blood is still getting through. This is why the first symptom of heart disease is sudden death for so many people. The body hides the problem perfectly, right up until the moment it cannot anymore. So what flips the switch? What turns a silent plaque into a fatal event? It comes down to stability. Some plaques are hard and calcified, stable, unlikely to rupture, but others are soft, filled with inflammatory material, covered by nothing more than a thin fibrous cap. Think of this soft plaque like a blister covered by a thin layer of skin. When blood pressure spikes during intense exercise, a moment of extreme stress, or even first thing in the morning when cortisol surges, that thin cap can tear. The contents spill into the bloodstream. Your body panics. It sees this as a massive open wound and immediately sends platelets to clot the blood. In minutes, that clot grows large enough to completely seal the artery. Not the slow buildup of plaque. A sudden, rapid clot. Like a cork in a bottle, blood flow stops completely. Heart muscle begins to die. This is why the majority of heart attacks happen in arteries with less than 50% blockage. Not the big stable plaques. The small, soft, unstable ones that nobody knew were there. There is another scenario that affects athletes and active people specifically. A 50% blockage means nothing while you are sitting on a couch. But when your heart rate climbs to 170 beats per minute during hard exercise, your heart demands a fire hose of blood. A partially blocked artery can only deliver a garden hose. The demand exceeds the supply. The heart muscle begins to suffocate. This is called ischemia, and it can cause a heart attack in someone with completely normal cholesterol levels and no symptoms at rest. The symptoms are different too. Men usually get the Hollywood version: crushing chest pressure, left arm pain. Women often experience extreme fatigue, nausea, or something that feels like severe acid reflux. Both can feel a sudden, unexplained sense of doom. If that feeling arrives, do not ignore it. Time is muscle. In the emergency room, this is not a saying. It is a biological reality. 20 minutes after blood flow stops, irreversible damage begins. 90 minutes in, heart tissue turns to permanent scar tissue. Scar tissue does not pump. Every minute matters. If the plumbing fails, cardiologists thread a thin tube through the wrist, inject dye to locate the blockage, inflate a small balloon to open it, and deploy a metal mesh stent that holds the artery open permanently. The technology is extraordinary, but the goal is to never need it. The best way to find a hidden problem is imaging, not standard blood work. A standard cholesterol panel tells you what is in your blood. It does not tell you if it is sticking to your walls. A coronary artery calcium score is a 5-minute scan that detects hardened calcium deposits in your arteries. A score of 0 is ideal. A score above 400 is a serious warning. A CT angiogram goes further. It can detect soft plaque, the unstable kind that has not hardened yet. This is the early warning system that catches the problem before it ruptures. Know your blood pressure. Know your fasting blood sugar. Do not wait for symptoms. The heart does not send warning letters. It sends events. The healthy heart attack is almost always a tragedy of ignorance, not of effort. Most people who die this way were doing everything right on the surface. They just did not have the right information underneath. Subscribe. Every week we publish the science they do not teach in waiting rooms. Drop a comment. Did this change how you think about your heart?